As temps fall, respiratory illnesses rise. As we prepare for the holidays, the State Department of Health is declaring the flu prevalent across New York State and asking families to take precaution.
Yeah, we don't have to read about this news. We hear it all over the place with those sniffles. Natalie Kutchko joining us now with more on where our region stands with all this. Natalie.
Yeah, Adam, Teresa, you could probably hear it in my voice. I've got some of that myself right now. From the end of November through the first week of December, COVID, RSV, and flu cases in Monroe County have all just about doubled. That's according to local data, but UR medicine specialists say what they're seeing right now is not nearly as much as this time last year or the year before. So across the state, it's a bit of a different story. The most recent data shows more than 23,000 positive cases across 60 counties and nearly 400 hospitalizations. Just to give you an idea of the sharp increase in cases from week to week compared to a week ago, cases went 75% outside of New York City. And because of the rise, certain healthcare workers in New York must wear a mask if they are unvaccinated. So I spoke with Dr. Paul Grayman with UR Medicine, and he breaks down the traffic we're seeing at our hospitals, how it's changed, and the precautions you should take to stay healthy.
So, week to week, we may be seeing the numbers of flu cases roughly doubling. In terms of the number of patients we have in Strong Memorial Hospital right now with these viruses, the numbers are fairly small. Between flu and RSV and COVID altogether, we have somewhere between 15 and 20 patients in the hospital. So those are not huge numbers. If you're sick, it's best to stay away from other people, and especially to stay away from people who are really vulnerable, like older people or people who have underlying diseases, and they're more susceptible, to get a bad case of a virus.
And doctors continue to encourage the community to get vaccinated for the flu, COVID, and RSV if eligible. Contacting your primary care provider first on any concerns, they say, is key. Right back to you at the desk.